Suswagatam. You are all welcome to Saspandan TCM Academy. Good evening to all. Today, I am discussing with you on the special subject, migraine headache. So, all headaches are the common, but migraine is very special. It is very difficult to treat. And many people suffering with the migraine with their entire life. They are going doctor. They are carrying file to file. But this migraine, they are suffering still. So, what is the migraine in general? Migraine is the neurological disorder that cause recurrent attack of the moderate to severe headache, usually affecting one side of the head. While it can occur on the both sides. It is much more than the simple headache. Simple headache, you can take the any pills, the painkiller, then simple headache will be stopped. But migraine headache is the very harder. During attack, many people also experience the nausea, vomiting, increased sensitivity to light, sound, and smell. They cannot tolerate the high light, high sound, or strong smell. Migraine occur because of abnormal activity in the brain involving the trigeminal nerves, brainstem, blood vessels, chemicals such as the CGRP, that is the calcitonin gene related peptide, and serotonin. So, who get migraine headache? More common in women than men. That is the ratio about the 3:1. In 4 people, they are migraine suffering to 3 for women and 1 for the men. Usually begins between 10 and 40 years of the age. Age factor is also important. Okay? Migraine usually begins between the 10 and 40 years of the age. You can hardly see above 40 migraine patient. Can occur in the children and the older adult. Also, it can occur in the children and the older adult and always run in the families. That is a genetic tendency. Common symptoms. We are discussing the migraine in the general. Okay. So common symptoms are before the headache. So occurs hours to 1 day before. There is the tiredness, mood changes, food craving, neck stiffness, and frequent yawning, and increased thirst, and patient difficult to concentrate, difficulty in the concentration. Aura, aura about the occur in about the 25 to 30% of the patient. What is aura? Last 5 to 60 minutes. Symptoms including flashing light, zigzag lines, blind spot, tingling in the face or the hands, difficult speaking, and temporary weakness. So in headache phase, typically last 4 to 72 hours. And that characters are moderate to severe pain and usually one-side pain. Throbbing or pulsating and worse without movement. Nausea and vomiting. Also the sensitivity to light, that is the photophobia. Sensitivity to light, the photophobia. Sensitivity to sound, it is the phonophobia. And sensitivity to smell, it is the osmophobia. Patients are suffering with these three phobia: photophobia, phonophobia, and osmophobia. Recovery post after the headache. So headache, after headache subside, so patient will be get the fatigue. Brain fog, weakness, difficulty concentrating, and mild scalp tenderness. Tenderness is there on the scalp. And this phase may last up with 24 hours. So how many types of migraine are there? So number one, migraine without the aura. That is the most common. Secondly, migraine with the aura. Third, chronic migraine. It is the 15 or more headaches per day or the per month. Chronic migraine. Okay, many people carrying migraine with their full life, entire life. So this is the chronic migraine. Then vestibular migraine. So dizziness. Vestibular migraine, it is the dizziness. Hemiplegic migraine. And menstrual migraine, when some ladies getting, they are on the menstrual cycle, they are also getting the migraine. Retinal migraine and silent migraine, that is the aura without headache. So, friends, I will provide you the recording. You can hear this session again and take a notes and understand this migraine. Okay, thank you very much. So why migraines come? Why people are suffering with the migraine? Common trigger spot factors. First is the lifestyle. Worse lifestyle. Stress, lack of sleep, or excess sleep, skipping meals, more fasting. People are taking the more fasting, and also the dehydration. People are not drinking enough water. Secondly, in case of food, those people are eating more chocolate. Chocolate, it is the positive factor for the migraine. Cheese, alcohol, red wine, processed meat, okay, processed meat, and excess caffeine. And when people withdrawal or caffeine, sudden withdrawal caffeine, all that also cause the migraine. Third, hormonal. In case of hormonal changes, that is the menstruation, pregnancy, menopause, birth control pills. It's caused to the migraine. Next, environment. Because of bright lights, loud noise, strong smell, weather changes, and high altitude. Risk factors are family history, those who can get the migraine. So, number one is the family history. And migraine, maximum percentage, female gender. Next, anxiety, depression, obesity, poor sleep, high stress. Then, what is the pathophysiology? Simple pathophysiology of the migraine. Migraine is believed to involve brain hyperexcitability, that is the brain neurological condition. Secondly, cortical spreading depression, especially in the migraine without aura. Thirdly, activation of the trigeminal nerves. And next is the release of inflammatory neuropeptide, especially CGRP. Next, temporary inflammation around the brain blood vessels. And pain signal transmission to the brain. Okay, this is the pathophysiology of the migraine. There are the much more can tell you, but this session one or two session is not enough to explain the migraine. So common associated symptoms. So migraine patients always suffering with the neck pain, eye pain, blur vision, dizziness, vertigo, scalp tenderness, and difficulty concentrating and fatigue. So let us, Sejalji, let us come to that subject. Okay. Today and tomorrow, I will explain all about the migraine. Okay. So diagnosis is the migraine is the diagnosed mainly by the clinical history. There is no single blood test for the migraine. And your family doctors maybe perform neurological examinations, MRI of the brain if the warning signs are present, and CT scan in the emergency situation, and the eye examination. Now, let us come to our subject. Migraine in the TCM. How we can manage the migraine with the acupuncture. As per the TCM, traditional Chinese medicine, our body has a meridian, energy pathway, through which qi and the blood flow. If the flow become blocked, weak or unbalanced, it can cause the headache for different types and the location of the migraine. So several meridians are involved, including liver meridian. So liver meridian is the closely connected with the head and the eyes because liver supply blood. Okay, liver store blood in the TCM. We say liver store blood. How many liver store blood? Anybody can tell me how many as per TCM? How many blood in the liver quantity? Come on, tell me. Tell me in the chat box. How many liver? How many blood in quantity in the liver? Yes, 1.5 liter. Yes, liver store 1.5 liter blood. So liver supply the blood to the head, neck, and the head. So when any spondylitis, neck issue, you have to treat with the liver blood deficiency. And secondly, if liver chi become blocked or liver yang rises upward, it can cause the migraine. And this type of migraine is always related with the stress, anger, frustration, emotional tension. And common symptoms are the throbbing headache, pain in the top or the side of the head, dizziness, irritability, and red eyes. After liver, gallbladder also responsible for the migraine because gallbladder travel in the head and it cover the maximum area of the head. And at the zigzag, you can see the flow of the gallbladder. It is the zigzag line on the skull. So the gallbladder meridian runs along the side of the head and it works closely with the liver because they are interior and exterior relations. They are husband and wife. Liver is the wife and gallbladder is the husband. So gallbladder works closely with the liver. And when this meridian is blocked, when gallbladder is blocked or imbalanced, it commonly uses one-side migraine because it's slow. And common symptoms are pain on the one side of the head, pain around the temple, and pain behind the ear, nausea, and sensitivity to light and the sound. The patient cannot tolerate the bright light and the too much sound. Number third, meridian. We discuss about the liver and the gallbladder that cause to the migraine. And number third, bladder meridian. The bladder meridian also travel on the head. So bladder meridian also responsible. The bladder meridian runs along the back of the head and the neck. And if chi and blood do not flow smoothly, it can cause headache and neck stiffness. And common symptoms are pain at the back of the head, occipital region, neck pain and stiffness, heavy feeling of the head, tension, headache, and the migraine starting from the neck. When the migraine starting from the neck, okay? Friends, please concentrate what I am telling. This is the diagnosis points. When migraine starting from the neck, so you understand it is the bladder related migraine. Then stomach meridian. Stomach meridian also responsible for the migraine. So stomach passes through the forehead, around the eyes and the face. If there is the heat or the blockage in the meridian, in the stomach meridian, migraine may be occur. And common symptoms of the stomach meridian migraine is the forehead headache and the pain around the eyes, temple pain, nausea or vomiting, and headache after overeating or the digestive problem. Number 5, triple hormone. Triple hormone also the responsible for the migraine when it's blocked. Triple armor meridian help regulate the body's chi circulation, body temperature, and a fluid movement. It runs along the side of the head, ear, and the neck. When heat or chi stagnation affect this meridian, heat and chi stagnation affect to the triple armor, Sancho meridian, migraine may be developed. And common symptoms of triple armor migraine is side of head pain, ear pain or ringing in the ear, tinnitus. When there is a tinnitus with the migraine, identify this is the triple armor migraine. Neck tightness, feeling of heat in the head, migraine triggered by stress or fatigue. Important. In TCM, migraine is usually not caused by only one meridian. So don't misunderstand. So only one meridian is caused. It is always due to underlying patterns. So you should understand the pattern identification. It is the underlying pattern, such as the liver yang rising, liver fire, liver wind, flame, dampness, blood stasis, chi deficiency, or kidney indeficiency. Affected meridian helps identify, okay, how you can identify. You understand which meridian is affected. When there is the blood stasis, okay, so meridian is affected, the heart, it is the spleen, also liver, dampness is the spleen, chi deficiency, spleen, and kidney indeficiency. So you have to go with the symptoms, take the patient's history. You have to go to the etiology and the chronology. So affected meridian help to identify where the pain is located. Let us discuss in sessions, okay? When whole head is paining. So affected meridian helps identify where the pain is located, while TCM pattern diagnosis explain why the migraine is occurring. Why there is the migraine? We have to identify the TCM patterns. So now let us discuss the migraine headache, etiology, chronology, disease pattern identification. So any problem, any suffering in the body, as acupuncturist, so acupuncture is the word science. When you got this science in your hand, so you have to go with the etiology, where disease start, when and where the disease start, etiology. Then chronology, how this is travel, and this is pattern, symptoms, the patient behaviors, how patient walk, how patient talk. So what is his voice level? So you can identify the disease with this three pattern. And also you have to take the constitutional history. What is the constitution? So every person have its unique constitution. So let us start with the etiology, migraine headache etiology, causes according to the TCM. Number one, external causes. External causes is the acute migraine. External causes. External causes bring the acute migraine. They are the wind cold invasion, external causes. Wind heat invasion, wind damp invasion. Then number two is the internal causes. They are most common. Internal causes. So emotional stress, internal cause. Anger and frustration, internal cause. Excessive mental work, poor diet, alcohol, lack of sleep, overwork, hormonal changes, and aging and constitutional weakness. So aging also the main factor and the constitutional weakness. Next, C, number third, main pathogenic factor. Pathogenic factors. Liver yang rising, liver fire, liver wind, chest aggression, blood stasis, flame, dampness, internal heat, indeficiency, blood deficiency, and kidney deficiency. Now, this was about the etiology. Now, chronology. Chronology is how disease travel, what is the duration and the stage of the disease. In case of acute migraine, always caused by the external wind, liver yang rising, liver fire, chi stagnation. Symptoms are sudden onset, that migraine happening suddenly, immediate, suddenly. In one moment, patient is normal. In second moment, patient is getting extreme migraine, acute migraine. It is a sudden onset, severe pain. It is the excess pattern. And when you see the pulse of the patient, it will be strong and tongue will be red. That is when tongue is red, that is the heat pattern. Then chronic migraine. What is the chronic migraine? That chronic migraine usually caused by kidney in deficiency, liver blood deficiency. Okay, G and blood deficiency, blood stasis, and flame obstruction. Again, repeating, chronic migraines are due to kidney in deficiency, liver blood deficiency, G and blood deficiency, blood stasis, and flame obstruction. Symptoms are recurrent attack. Okay, so patients always suffering recurrent attack. So in his full life. So long history and mixed deficiency and excess. Causes are deficiencies, also the excess causes. Dull or persistent pain and fatigue after headache. When headache stops, there will be fatigue. Now, this is pattern identification to the migraine. Excess pattern. Okay, excess pattern and deficient pattern. We are discussing now excess pattern. Excess pattern is the liver yang rise. Liver yang rise. This is the excess pattern. Symptoms are throbbing headache, dizziness, irritability, tinnitus, and red face. Then next, according to the in liver yang rising, according to the treatment principles, tell in the TCM. This treatment for the liver yang rising, so liver yang ascending, liver yang rising means liver yang ascending to the brain. It is the hyperactivity of the liver yang. Is based on the four principles. Okay. So pacify and subdue liver yang. Nourish liver yin. That is the treatment principles. Specify, subdue liver yang, and nourish liver yin. When we increase, we supply the water, the flame will be come down. Rising will be come down. So nourish the liver in. So nourish the kidney in also. Kidney is the mother of the liver. Okay, we have to nourish the kidney in also. This is the root. And extinguish the internal vein and the calm the shell when present. We have to close, we have to extinguish internal vein. So points are, don't write down. I will provide you the PDF. First point is the liver 3. This is the chief point, main point to specify the liver yang, regulate the liver chi, relieve migraine. Then gallbladder 20. This point eliminate liver wind, subdue liver yang, relieve occipital headache and the dizziness. Next, gallbladder 8, GB8. GB8, about the 1.5 tune, about the year, 1 GB8. So this is the major local point for the temporal migraine. GB43 on the dorsal foot, GB43. Clear gallbladder fire and benefits the Shaoyan migraine. Then liver 2. I hope you all aware about this point's location. Okay, is it? Liver 2, clear liver fire, supplemented, and with the liver yang rising. Then spleen 6. This point nourishes the liver, kidney in and anchor the yang. Okay, this is the junction point of the 3 foot in meridian species. Then liver 8. This is the hasty point of the liver and water point of the liver. This tonifies the kidney. So, sorry, liver. This liver 8 is the nourishes the liver blood and the liver in. And kidney 3, this tonify the kidney in and anchors the rising yang. Liver 4, Li4, Li4 move chi, relieve pain and descend the yang. Okay, when we are applying the Li4 and liver 3. Okay, this is the most powerful effect on the rising energy. We have to sedate this point. Pericardium 6, calm the Shen. Shen resides in the heart, in the pectoral region, and this is the distal point for the chest. So, pericardium 6, the calm the Shen, relieve the nausea and the migraine. Du20 regulate the ascending yang and clear the head. And Taiyang, this local point for the temporal headache and the migraine. And the GB9, okay, 1.5 posterior to the GB8. This is the local point for the temporal headache due to your yang. So, how you can needling technique? You have to reduce liver 3, GB20, GB8, GB43, liver 2, Li4, Du20, Taiyang, and GB9. And you have to tonify kidney 3, SP6, and liver 8. And this treatment targeted to calm the excess, that the rising yang while nourishing the underlying the yin deficiency that allow the yang to rise. When there is the yin deficiency, there will be yang will be excess. Now, main thing, we are needling this point. Don't needle this point with the randomly. Okay? So sequence is there. You have to keep sequence to needle the point with the every protocol of acupuncture. You have to keep the sequence. So it is the meridian circuit system, meridian circuit sequence. So we discussed this point. So sequence is, first point is the LI4, then second is the SP6, then third is the kidney 3, then fourth is the liver 2, fifth is the liver 3, sixth is the liver 8, 7 is the GP 20, 8 is the GP 8, 9 is the GP 9, 10th point is the GB 43, 11th point is the pericardium 6, then DU 20, and last Talia. So this order, this sequence follow the meridian progressions. So meridian progression is the large intestine to spleen, to kidney, to liver, to gallbladder, to pericardium, to governor vessel, DU or meridian, to the extra. Now, let's discuss liver fire blazing. This is the other excess cause, excess pattern for the migraine headache. Liver fire blazing. Symptoms are severe temporal headache, red eyes, bitter taste, constipation, anger, red tongue with the yellow coating. So when you see the yellow coating on the tongue with the red, identify it is a liver fire blazing. It is the heat symptoms. So in case of liver fire blazing, treatment principle are to clear liver fire, drain excess heat, subdue rising liver yang, and clear gallbladder heat, and relieve migraine pain, and calm the shin. Points are liver 2. This is the chip point, and drain liver. This point, the drain liver when you sedate. Drain liver fire and clear heat, stop migraine. Then, secondly, liver 3. This point, when you apply this point, spread liver chi, subdue liver yang, clear liver fire. Then GB43, clear gallbladder fire, benefit temporal migraine and the Shaoyang headache. Then GB20, eliminate wind. This point eliminate wind, GB20, eliminate wind and heat. This point clear head and relieve dizziness and the migraine. Then GB8, it is the primary local point for the temporal migraine. Then GB9, this is the local point for the temporal headache and the liver fire migraine. Then Li4, this point, move chi, relieve pain, clear heat from the head. Then Li11, this is the powerful point to clear excess heat. Li11, this is the hazy point on the large intestine. Li11, powerful point to clear the excess heat and the fire. Then in town, it is the local point for the temporal migraine and the severe headache. Then Du20, clear the head and regulate ascending yang. Then pericardium 6, calm the shame, relieve nausea associated with the migraine. Then heart 7, calm irritability, insomnia, and agitation due to liver fire. So needling technique, which point to sedate and which point to tonify. So you have to sedate liver 2, liver 3, gallbladder 43, gallbladder 20, gallbladder 8, gallbladder 9, Li4, Li11, Du20, and Taya. This point you have to sedate. Then you have to treat this point with the even method or the tonification method or mild tonification. Pericardium 6 and heart 7. So now most important, okay? Don't forget to meridian circuit sequence of this point. Li4, first point is the Li4. Then Li11, then liver 2, liver 3, then GB20, GB8, GB9, then GB43, pericardium 6, heart 7, Du20, and Thaia. And this sequence, meridian circuit sequence, follow the classical meridian progression. So large intestine to liver, to gallbladder, to pericardium, to heart, to duodenum, and to extra. Then third pattern is the liver chi stagnation. Liver chi stagnation, also called migraine headache. Symptoms are stress induced migraine, emotional changes, chest tightness, sighing, okay? It is the sighing, hypochondric pain, hypochondric pain. So treatment principle for the liver qi stagnation: smooth the liver, move liver qi, regulate qi circulation, harmonize liver and gallbladder, relieve migraine, and prevent liver qi from the transforming into liver fat. And this pattern is commonly related with the migraines triggered by the emotional stress, anger, frustration, anxiety, or premenstrual tension. And if prolonged, this, these symptoms are prolonged, so liver qi stagnation may transform into liver fire or liver jam rising. You have to treat immediately when there is a liver qi stagnation. When liver qi stagnation is untreated, it may transform into the liver fire or liver jam rising. So, liver qi stagnation points are the liver 3. This is the chief point. This point spread liver qi and relieve stagnation and stop migraines. Then Li4, liver 3 and Li4 are the foregate points. So Li4 regulate qi, move stagnation and relieves headache. This is the foregate with the liver 3. GB34. This point spread liver and gallbladder qi, benefit Shaoyang channels and relax tendons. 1 minute. Then triple or more 5. This point opens the Shaoyang channel. Triple or more 5 opens the Shaoyang channel. Relieves the temporal migraine. Then gallbladder 20 benefits the head, relieves migraine and the neck tension. GB8, this point, primary local point for the temporal migraine. Then Taiyang, this is the local point for the temporal headache and the migraine. Pericardium 6, it is this point regulate qi, calm the shade and relieve nausea and emotional stress. Liver 14, this is the front view point of the liver. Front view point of the liver. This point spread liver qi and relieve hypochondric tension. Then GB41. This point move gallbladder qi, benefits temporal headache and the Shaoyang disorder. Then in tongue, in between two eyebrows. This point calm the mind and reduce stress and emotional tension. Needling technique, which point you have to sedate and which point you have to tonify. First, you have to sedate liver 3, Li4, GB34, HA5, triple honor 5, GB20, GB8, GB41, liver 14, and thigh. And you have to prick with the even technique. No sedation, no tonification, pericardium 6, and intact. And retention for the needles time duration 20 to 30 minutes. And treatment frequency 2 to 3 sessions per week during the acute stage, then weekly as the symptoms improve. Now, meridian circuit. Meridian circuit sequence. First point, source point, LI4. Then liver 3. Liver 3 also source. Liver 40, GB20, GB34, GB41, GB8, triple number 5, pericardium 6, in tongue and thigh. And this meridian circuit sequence follow the meridian progression. So large intestine to liver, liver to gallbladder, gallbladder to triple organ to pericardium, and pericardium to extra point, thigh and intact. Then number 4, okay, excess pattern, blood stasis. Blood stasis. Symptoms are fixed stabbing pain. It is the when migraine pain is the fixed stabbing, and chronic migraine and pain was at the night. Pain was at the neck. And when you see the tongue is the purple color of the tongue. So identify it is the blood stasis migraine. So TCM patterns of the blood stasis treatment principles. So you have to invigorate the blood, you have to move the blood and remove the blood stasis. Open the channels and the collaterals, relieve pain, regulate chi. And so with chi, why you regulate chi? Chi and blood move together. In TCM, in traditional Chinese medicine, blood stasis migraine is by fixed stabbing or boring pain, chronic recurrent headache. Headache comes and go always chronically. Pain at the same location, and that pain was at the night, and always follow head trauma or long-standing liver chi stagnation. And tongue is typically dark or purple with the purple spot. And the pulse is always choppy or wiry. Now, points are, we are using points for blood stasis. SP10 on the thighs, inner side, inner thighs. Okay, this is the cheap point main point to treat the blood stasis. This point invigorate blood and remove blood stasis. Then bladder 17, it is the influential points of the blood, and this point moves blood and resolves stasis. Then liver 3, move liver chi and the blood and relieve pain. Li4, move chi and the blood, relieve headache. This is a foregate with the liver 3. Liver 3 and Li4 are the foregate. Then sp6. This point invigorate blood and harmonize the liver, spleen, and the kidney. This is the junction point of the liver, spleen, and kidney. Put in meridians. Then GB20. GB20, this point benefits the head and relieve the migraine. Then GB8. GB8 is the main local point for the temporal migraine. Then Taiyang, local point for the migraine and the temporal headache. And also find the Ashi point, painful points, needle tender area of the headache to improve the local blood circulation. And DU20, this point promote the circulation in the head and relieves the pain. So how to needle with the sedation and the accommodation? First you sedate sp10, bladder 17, liver 3, Li4, GB20, GB8, Taiyang, and Ashika. Then even technique, no tonofiction and no sedation to the sp6 and the DU20. Retention time for the needle of the 20 to 30 minutes. And treat 2 to 3 sessions per week until pain decrease, then adjust according to the clinical response. Then how you manage meridian circuit for the protocol, this protocol, blood stasis. You have to apply first the source point, Li4, then sp10, then sp6, then liver 3, then GB20, then GB8, then bladder 17, then DU20, Taiyang, and Ashika. This meridian circuit sequence follows the classical meridian rules. So large intestine to spleen to liver, liver to gallbladder, gallbladder to urinary bladder, bladder to governing vessel, DU meridian to the extra. Now, flame damp obstruction. Flame damp obstruction. Friends, you can listen this recording again. So because the syllabus is very big, I want to finish this in 2 days. So flame damp obstruction. Symptoms are heavy head and dizziness, nausea, vomiting, foggy thinking, and when you see the tongue, it will be thick, greasy tongue coating. Okay? Pattern is the flame dam obstruction. So all are requested, please open your videos. Let me understand. I have to take energy from you. Otherwise, I am getting bored. When I watch your smiling face, I take energy from you. All are requested, please open your videos. Flame dam obstruction. TCM patterns. Treatment principle is the resolve flame, transform dampness, strengthen the spleen, harmonize stomach, open the clear yang to the head, relieve migraine. And this pattern typically present with the heavy or dull headache and sensation of the head fullness, dizziness, nausea, vomiting, chest operations, poor appetite, excessive sputum, and greasy tongue coating and a slippery pus. Points are when dampness, we are always selecting the ST party, damp and the flame. ST40 and SP. So ST40 is the chief point, resolve flame, transform dampness, and clear the head. SP9, this point drain, dampness, and the promote fluid metabolism. The next point is the SP9, strengthen the spleen, resolve dampness, harmonizes the 3 channels. ST36, tonifies spleen and stomach chi, support transformation of dampness. Then RAIN 12, CV12. This is the front view point of the stomach. RAIN 12 is the front view point of the stomach. This point harmonize the middle burner and the transform the flame. Then pericardium 6, this point harmonize the stomach, relieve nausea and vomiting, calm the shed. Then DU20, this point clear the head, relieve migraine and the dizziness. GP8, this is the primary local point for the temporal migraine. LI4, move chi, relieve headache and the pain. This is the analgesic point of the body, LI4. So Taiyang, this is the local point for the migraine and the temporal headache. And DU20, raise clear yang to the head. So in case of clear yang, we have to use the DU20. It's clear yang, raise the clear yang to the head and relieve the heaviness. Then how to needle? sedation, and tonification. So ST40, SP9, SP, CV12, GB20, GB8, Li4, Taiyang, you have to sedate. Again repeating, ST40, SP9, CV12, GB20, GB8, Li4, Taiyang, you have to sedate. And you have to tonify ST36 and SP6. And you have to use even technique. No tonification, no sedation, pericardium 6 and D20. And you have to retain the needle 20 to 30 minutes. And treat patient 2 to 3 times in the week. So meridian sequence, meridian circuit sequence. Very important in every protocol. You have to make the meridian circuit sequence. First point, always take the Johnson's point in any protocol. So Johnson's point is the Li4, then the ST40 leaf code connecting point, then ST36, SP9, SP6, pericardium 6, GB20, GB8, then CV12, DV20, and Taiyang. And this meridian circuit sequence follows the classical meridian progression. That is the large intestine to stomach, stomach to spleen, spleen to pericardium, pericardium to gallbladder, gallbladder to brain vessels and governing vessels and the extra. Okay, so now I'm going to hand over the session to the Alice. Alice, you are unmuted. Please summarize this session.
Vivek, I was driving most of the session, so I maybe not that good at the summarizing right now.
So whatever you attended the session, you summarize.
Okay, we have passed the migraine and the patterns of migraine. It could be during the blood stasis, flame. Yes, that's what I heard. If we are speak about the blood stasis, the signs will be purple tank with the purple points. The pulse will be choppy. The pain will be stubborn, and very important, it will be at night. And then we will use the points that will vigorate blood. And one of the main points is spleen 10 and bladder 17. They are vigorate the blood. If we are speaking about the flame dam pattern, we will see in the tank the coating. It will be or yellow or grease yellow or maybe even gray coating. Then we will see it in the slippery pulse, and the pain will be let's say, like something stuck in our head, and it will be persist, and heaviness. This is the main point in this. Then what we have to do to use points to take care of the damp and the phlegm. The main points here will be stomach 40, then spleen 9, and we need to strengthen the stomach and spleen, so we will use CV12. That's it, I think. The session must be done three times in the week. Then, according to the pattern, or once in the week, or according to the pattern, whatever it needs. That's what I got.
Okay, thank you, Alice.
Thank you.
So tomorrow we have also session. It will be start at the 8 p.m. India time, 8 p.m. Okay, so all are requested to join the session in the time. Okay, so thank you very much. Ending the session. So whatever your queries, you may ask on the group. Okay, ending the session. Thank you very much.